So let's jump to CMS findings. So I'm going to share with you findings that are direct from the government. These are not Healthways findings. The CMS engaged independent evaluators in order to cross those with the criteria scorecards for success, the different metrics that were the key endpoint metrics for this study. And I'm sharing with you our final results. This is the first time these results have been shared from any of the Medicare Health Support organizations that were involved in this project. So this is breaking news in its own right. Obviously, one of the things that the idea here is the way you create savings in this population is not by aiming at the savings. You have to aim at the health and the clinical pathways and the support that people are getting in and around their own self-management and making certain that they're coordinated well with the providers that are helping them. One of the key measures was moving clinical metrics, and we achieved 92%. One small fact, all the people that participated financially had to do these programs, and your reimbursement was a true pay for performance. If you did not deliver on the outcomes, you got paid nothing. We also, these programs, and I say these programs, because the attrition rate, or simply the death rate in this population, was about 1 to 1.5% per month. That gives you also a sense of how old these people were. A year into the program, the government wanted to amplify the membership in the study group in order to keep the N of this study up. So we have original cohort, all 3 years, and then a refresh cohort, which was the last 2 years. In both of those programs, we created gross savings, and obviously one of the measures of success in this was that these programs not only drive clinical performance and gross savings, but once the costs of the program were considered in, can these achieve a budget neutrality or better? And obviously our refresh population took the learning from our first year, and the last 2 years afforded us the opportunity to do that. So net savings on that refresh population. And then the government reported through their audit and independent third-party review, 94% beneficiary satisfaction. So you think about this equation. You have to provide coordinated care in concert with the existing system for people that are not in a particularly well-organized and managed environment, and gain their trust, deliver the support that they and their providers would say, this is a better way, and in the end, return the economics of short-term return on this. So with our report, we were very excited that CMS reported to us that we had met that scorecard. There have been reports to Congress along the way, and there's another report coming, but process of care was a very important part of the report back to Congress. Was this just simply another ploy of a managed care mentality to deny utilization of these people to the resources they need, or was there actual improvement in the care processes that were critical for these people? We were the only MHSO, or Medicare Health Support organization, to achieve and reach the goal on all 5 key processes that were being looked at by independent evaluation. One of the key themes of this is going to be in the economic equation, and certainly the experts can opine on this some more. We got about an 89% consent rate. Now, our consent wasn't take our word for it. It was subject to audit by CMS. So if you were declaring that someone was in this program, you had the burden of proof to show that, yes, they had consented. It was either recorded audio or written consent from the population. It's a pretty high consent rate within the target group. And then the question became, okay, fine, you can get them to commit, but can you keep them engaged? Now, mind you, all these data includes that 1 to 1.5% decrement in this population per month. We maintained 65% continuous participation in the program, which these statistics, if you don't have an appreciation for some of the commercial data and models, are exceptional. Some of that is the nature of where these people are in their life, but also the reflection of the need that they have for the kind of support that was being delivered here.